My name is Jennifer Simmons, and I am your licensed medical coding instructor with Certitude Health Coding Educators. In this lecture, I'll be talking about the journey to medical coding with Certitude Health, and this will kind of be your introduction to the course as well as to the career field of medical coding. The things that we're going to talk about today are an introduction to coding and what coding is, as well as who Certitude is and what we stand for. You're also going to learn a little bit about my background as an instructor, the American Academy of Professional Coders, who's our licensing entity, and we're going to define medical coding, of course, and then we're also going to give you a course description talking about the exam as well as professional growth and development. So let's get to it. So what is Certitude, or the question should say, who is Certitude? Certitude is an independent school. We are with the state of South Carolina. We're listed as a vocational or trade school with the primary focus of medical coding and associated job areas in healthcare. Our mission is to enhance job opportunities in the community by providing skills where students will be able to proficiently and accurately code a medical chart. And this course is to prepare you for the National Certification Exam. Our goal is to maintain a 95% or higher success rate of students who not only take and pass the course, but also pass the certification exam. At the end of this course, I'll also be providing you with some developmental tools and tips to help you create your resume, your cover letter, and basically your portfolio and everything that you will need to help you properly network and be able to become gainfully employed in the career field of medical coding. So let's first talk about who it is that licenses and certifies medical coders, and that's the American Academy of Professional Coders. They are the world's largest association representing medical coders, billers, auditors, compliance and practice managers, as well as providing the largest network for medical coding and billing with over 155,000 members worldwide. So the course that you're taking now, you take that certification exam, you can get a job anywhere with that credential, with that certification. It is not just based on South Carolina, North Carolina, Georgia. It is a national certification. APC certification is also considered to be the standard in the healthcare industry. So if you want to do a little bit of research on that, if you just go out on Indeed.com, maybe some people still use Monster.com, but wherever you do your job search and type in medical coder, you'll see that the qualifications for that role is for you to have a certification from AAPC, which is again the American Academy of Professional Coders. So what exactly is medical coding? You hear the term kind of thrown around and you hear people say it, but really what is it? Medical coding is a translation or transformation of healthcare diagnosis codes, procedures, medical supplies, and equipment into medical numeric or alphanumeric codes. So the insurance companies, they speak in the language of these codes. When a hospital or a doctor's office has to bill an insurance company on the patient's behalf, they don't send a full detailed report to say what the patient had done. It's simply communicated to them by the use of a specific code. So if the patient has, let's just say, a diagnosis or a condition of hypertension, there's a code for that. The code is I-10. If the patient has type 2 diabetes, there's a code for that. The code is E11.9. If the patient comes in to the emergency room and they're complaining of chest pains, there's a code for the chest pains, which is R10.9, I believe. So many codes. I don't expect y'all to remember them all. I just know because I've been encoding for 20 years. But there'll be a code for chest pain, which is what they came in for, or what their diagnosis was. And then there'll also be a separate code or an additional code for the ER visit, which could be anywhere from 99281 to 99285. And then if there were any other testing done, say an EKG for the chest pain or chest x-ray, there would be codes for every single thing that was done and for every single condition that the patient has. Then you have codes for equipment, supplies, and drugs. So if the patient is given an aspirin while they're there in the emergency room for that chest pain, there's a code that is used for the aspirin. If they are being sent home with a heart monitor for that equipment, there's a code for that. So essentially, the codes just tells exactly what was done and why it was done, and how much of it was done. So, the code also could represent a quantity. Say, for example, if they were given 2 aspirins, or 2 Tylenols, or what have you. The code would be, representative of how much of that medication the patient was given. So that's the first part. It's a translation of all of those things. So the doctor can verbally write hypertension, but now the coder has to come in and assign that hypertension diagnosis, the verbal diagnosis. We have to assign it a code. So the next bullet says the diagnoses and procedure codes are taken from the medical record documentation, such as the transcription of the physician's note, laboratory and radiologic results. For every injury diagnosis and medical procedure, there's a specific code, a specific and a corresponding code. There are a number of sets and subsets of codes that comprise thousands of codes for medical procedures, outpatient procedures, diagnoses, inpatient. There's codes for anything, as I said, that is either done to the patient, given to the patient, or any testing done on behalf of the patient in order to determine the diagnosis. There are a number of those sets and subsets, and medical coders review the clinical statements and assign standard codes using 3 sets of codes. These are the 3 sets. The CPT, which is current procedural terminology, the ICD-10-CM, which is the International Classification of Diseases, version 10, clinical modification. So those are your diagnosis codes. And then the HCPCS level 2, which are the codes that are utilized for your drugs and supplies. And we'll deep dive into that later during the course, but this is just kind of like a general overview. So further, let's talk about medical coding and what role it plays in the flow of a patient visit. So medical coding actually falls under a portion of healthcare that they refer to as revenue cycle. And that is because once an account is, or once a patient is seen, that actually starts their revenue cycle process of that particular visit from start to finish. Actually, it starts at the point of scheduling your visit, because when you schedule your visit, they verify at that time if you have a specific type of insurance, the insurance verification. That determines if your visit will be covered by your insurance. That determines if there is a particular copay that needs to be collected at the time that you check in. Also, and these are the steps of that medical billing workflow or that revenue cycle process for a particular encounter or visit. And those will be terms that you'll hear used interchangeably throughout the course. An encounter is a visit. So step 1 is insurance verification. Step 2 is patient demographic entry. Your demographic information is your home address, phone number, contact information, emergency contact. It could include your insurance info as well, but any type of information that identifies you as the patient. Then you go in and you see the doctor. After you schedule your visit, they verify your insurance, you check in, that's verifying your demographic information. You see the doctor. after you see the doctor generates a report that then goes to the coding team in order for them to assign the proper codes based off of the doctor's documentation in that report. So he will say that the report has four parts to it. The basics of that is a chief complaint, reason for the visit. He'll get a history from you, a history of the current chief complaint that you have, as if, for example, you had a headache for 3 days. You tried taking Tylenol. Tylenol didn't work. In addition to the headache, you have sensitivity to light as well as nausea. So he will use that information from the chief complaint and the history to determine what types of or how in depth his exam with you should be, as well as if there needs to be any other diagnostic testing. That would be labs, radiology. Again, all of those are a part of your visit. And that is the types of things that we'll see as a coder documented in the progress note or the clinic note for that particular visit that the patient had with the doctor. From that report, the coder is able to what we call abstract or pull out information necessary to be able to apply the proper code. So once the account is coded, then it goes to the next step in the billing process, which could either be charge entry, or if it's all done electronically, then that eliminates the charge entry step. So this is, general, but it could get very specific depending on if you're working for a larger hospital or a smaller doctor's office. But after the coding charge entry process comes the billing. Billing is what we call claim submission, because we are creating a claim by coding the account and making sure that the charges are entered into the system so that that bill can be generated or that claim can be generated that's going to be sent to the insurance company. So just kind of think about it from your own personal experience in visiting and seeing your doctors. Once the claim is sent to the insurance company is going to do one of two things. They're either going to provide payment on that claim, or they're going to deny that claim. If they provide payment, then that means a check goes to the doctor's office or to the hospital for them to make sure that that payment is entered and applied to the system, so that whatever the balance is left, that's going to be billed to the patient. If the insurance company does not make payment and they deny the claim, it could be for a number of reasons. Maybe you didn't meet your deductible. Maybe it was not an authorized service, or it could have been that the coding was incorrect. So this is kind of where coding, or why coding, is a part of that revenue process. Because coding actually drives the revenue process. It all starts with coding. If the codes are not correct, the payment's not going to come in. If the codes are correct, the payments are going to come in and flow as they should. Whenever there's a denial, there's a team that works at specifically in a hospital or a doctor's office, or a central billing office. A lot of places are now having billing and coding separate from their clinical side, so they have a central billing office that's outside of the hospital. However it may be, there's a team that works denials specifically. That team has to have a coding background and coding experience. So you could kind of paint the picture, or just see the illustration that with a coding certification, you could be a coder, someone who actually codes the accounts, or you could be someone working in denials management, doing the research on the account to see why it was not paid, and if coding was indeed the reason that it wasn't paid, then what is the proper code that should have been billed in order to receive payment on that account. So that's what denials management is. Then you also have AR follow-up. So AR follow-up is accounts receivable. They will make sure that the patient is getting the bills that they need to in order to receive full payment or full reimbursement on that account for the services that were provided. And then lastly, there's reporting. So reporting is also a big part because it helps to understand, it helps us to understand, those who work in coding, charge entry, claim submission, payment entry, denials, to understand if all of these steps in the process, even, the insurance and registration, if all of those steps are functioning as they should. The report should show that there's minimal errors, that there is payment coming in as it should, that patients are being billed, um, and that's how we make the determination of whether or not the medical billing workflow is functioning properly. But this is the workflow. So as a coder and having that coding background, you can work in any portion of this, but obviously, being a certified coder, this is going to be your first point of interest and where you want to try to secure employment. Let's go to the next slide. So where can you work as a medical coder? It's the obvious thing now. Many people want to work from home. I think COVID really brought that home for people to want to work in the house so that they can be safe and and protected. Medical coders have been working remotely for about 20 years now, so it's not new or strange to us to work from home or work remotely. Most companies have it set up to where if hired for you to work remote, they will send you the equipment that you need, or if you have a computer at home, they will give you the instructions on how to download their software so that you can indeed work remotely and you would have access to all the same information as anybody inside the hospital facility would. You can work in a clinic. Doesn't have to be a hospital, doesn't have to be a doctor's office. It could be a clinic, it could be a government office. So we'll learn in chapter 1 of the course that medical coding and billing is all legalized by the federal government, meaning that all of the rules and regulations that we have to adhere to as coders are all mandated by the federal government. So Medicare, for example, Medicare, Medicaid, there is the entity of government called the Center for Medicare and Medicaid Services, known as CMS. They are one of the major governing entities for the federal guidelines that we have to adhere to for coding. So you can work for Medicare, you can work for the VA, that's also government, insurance companies like Cigna, United Healthcare. Cigna is a big one because I see them advertising a lot for certified coders. So the reason that an insurance company would want a certified medical coder is so that they can justify payment. Should we be paying this claim? Is this claim coded correctly? So just like we have a responsibility, at the hospital or the doctor's office to code the account correctly, the insurance company's responsibility is to see if what we coded was correct. Because if not, they're going to deny it. Their function is to save money. Our function is to make money. And so, of course, they would want to have certified medical coders there. Again, doctor's offices, consulting firms. There are so many consulting firms that I could name, even down to some of the ones that you may even be familiar with, but don't know that they are consulting firms for healthcare. So 3M. 3M is a big software company that provides different types of computer software, big in healthcare. Epic, Cerner. These are all companies that provide software, but they're also consulting firms because organizations consult with them to see if what they're doing and how they're functioning in their workflow processes is the best flow of work to bring in the most amount of money. So, obviously with any business, it's all it's a money game, but also in healthcare, it's more than that, and it's deeper than that. As a coder, a lot of people think that in healthcare, it's the doctors and the nurses that are making the biggest impact, and they're making a huge impact, clinically. But then you have the administrative side of healthcare, which is where we fall in that revenue cycle process as coders, where we still have a responsibility to the patient, because no patient wants to get a bill because their account was coded incorrectly. If that can be avoided, like, our responsibility is to make sure that everything we do is to do it right the first time. That eliminates frustration on the patient's part. Then the patient wouldn't have to have these bills on top of what they're already dealing with their illnesses. So let's talk about the job market analysis and salaries for medical coders. And this is based off of the data from 2012 to 2013 from the U.S. Department of Labor. And these numbers are still pretty accurate. So first, they said, according to the U.S. Bureau of Labor Statistics, jobs for certified medical coders will increase 22% through the year 2022. That is the year that we're currently in, and I can tell you that medical coders are in high demand. So this is absolutely correct and still stands true. A high demand for coding services as the healthcare industry continues to grow and the country's population ages, in addition to the increasing number of tests, treatments, and procedures. At the time they put this data out, they had no idea that COVID was coming. That in itself has created a higher demand for medical coders. A growing number of professionals needed in the field to act as liaisons between healthcare facilities, insurance companies, and other establishments is needed desperately. So if this is something that you are truly passionate about and really wanting to do, you've made the right decision to do it now. So salaries for medical coders. And this is all based off of data that I pulled from the American Academy of Professional Coders, which they in turn also got from the U.S. Bureau of Labor Statistics. But if you look at this map, it's broken out regionally. So being in South Carolina, North Carolina, Georgia, we are in the Mid-Atlantic region. I'm sorry, we are in the South Atlantic region. And in the South Atlantic region, you can see that this is our average entry level at $55,896 a year for salary. That would equate to about $26 per hour for someone with no college degree, no medical experience, but you have the certification. The certification is what is required, because with that certification, we are speaking the language of a physician. We have to learn the same things that a doctor has to learn in their program, except we're not taking care of patients. But we're understanding how the doctor is taking care of patients. So we have to know how to speak their language. And that's what warrants the higher pay for medical coders, is because the role is so very specific in detail. And that 26 per hour, this average, is based off of, again, entry level, no college degree, but you have the certification as the credential is CPC, so certified professional coder. The average medical coder with a college degree earns more. It could be potentially $30 per hour, and that is, of course, going to vary based on location. Coders in South Carolina don't make what coders in Atlanta may make. Just the reality. Coders in South Carolina don't make what a coder in Charlotte may make. But it's all based, again, on geographical location, cost of living in that particular area, which is why you see such a huge variation in some of the salaries. Here in the East, South, Central, thank goodness that's not where we are. They're probably the lowest on the map. That's Alabama, Kentucky, Mississippi, Tennessee, based on cost of living. But if you look over here, and if you've ever been to California, you know it's a little bit more expensive over there on the West Coast than it is here on the East Coast. So you can see that their average salary accommodates for that. Medical coders who specialize and certifies as a certified professional medical auditor or certified physician practice manager average over $30 an hour. So there are a variety of certifications and credentials that you can earn through the American Academy of Professional Coders, which you are certainly welcome to explore. But the base certification, the base credential that you must have in order to pursue the others is the one that you are pursuing with this course, which is the CPC, or Certified Professional Coder. The course curriculum is laid out into 20 chapters. It's PMCC because it stands for Professional Medical Coder Curriculum. And these are the 20 chapters. So we start out learning about the business of medicine, which talks a lot about those legal guidelines, some of the laws that we are impacted by, and that we have to know in order to be able to effectively code. Medical terminology and anatomy is really the base of the course. This is your foundation. We spend 2 weeks, 1 to 2 weeks on this chapter. However, I have recommended that there are some additional tools that will be helpful to you that you can purchase via Amazon on the topics of medical terminology and anatomy. And also, if you have a medical dictionary, doesn't have to be an expensive one. There's I think it's a Merriam-Webster. That's like $7 also that you can get on Amazon, just to have, as an additional study tool. But these again are 20 chapters, and they range from the specifics of diagnosis coding, which is the ICD-10-CM, CPT coding, which is the procedures and office visits, and then the HCPCS level 2, which is the drugs and supplies and equipment. And then your chapter starting with week 7 or chapter 7 to chapter 15. 7 through 15 goes through all of our body systems. So we'll talk about integumentary, which is the skin, musculoskeletal, respiratory, cardiovascular, digestive, the male and female reproductive system, the endocrine and nervous system, the eye and ocular and nexa, which is your eyes and ears, the auditory, and then we'll go into other special services like anesthesia, radiology, pathology, evaluation and management, and medicine. So it's a full load of coursework, and it's 16 weeks, 4 months. We will meet weekly, every Tuesday, from 6:30. I think I changed the time to 6:30. So we'll meet every Tuesday, and the time will be updated. You'll get that via email. And it's a virtual class. So we utilize the virtual online tool of Canvas, which I will be sending that detail to you via email. So also included in the course are some additional, there's your books, but also included are, in addition to your 2022 ICD-10-CM, HCPCS, and CPT coding books, is the PMCC textbook and workbook. So this is where a lot of your assignments are going to come from, your homework assignments. This is very imperative that you really commit to doing the work. Again, this is preparation for the National Certification Exam. The exam has 100 questions, and it's a 4-hour exam. 100 questions in a 4-hour exam. That means that any piece of information that you get from the course, whether it's through your textbook, through a lecture, can all be on your exam. Now, as we get further into the course, we'll start breaking down, what and how you should study and further prepare for that. But your really going to get an overview of everything. Um, Staying in the study material is going to be important, not just looking at it one day a week, but really making it a part of your life. And I really like to have this conversation, with people to help you to understand that it's not something that you can cram. It's going to be a lot of work. You're investing in yourself. And so, not only your finances, but you will need to invest your time as well to ultimately determine your own success for the course. You also have um, a one-year AAPC membership. So you're going in with the student membership for your first year. After that first year, you'll be responsible for maintaining your membership with the American Academy of Professional Coders. This is how you also maintain your credentials once you become certified. In addition to that, for the 1 year, you will also have a CPC 50-question practice exam. So if your certification exam is 100 questions, practice exam is 50 questions. Those practice exam questions you could potentially see again on the actual exam. So again, I would encourage you to make sure that you're using all of the resources available to you. You also get a monthly subscription for your first year and following years, but you will get the Healthcare Business Monthly Magazine subscription. This is a great magazine. It has articles about coding procedures, healthcare advancements, what's new in healthcare. And that can either come to your home or it can come to you via email. You'll have to set that up in your profile, which I'll also we'll talk about later. And then not only that, because you are a student of this AAPC course through Certitude Health, you will be eligible to receive a free subscription of the For the Health or For the Record magazine. Again, another great tool, great for networking, great for job searching, just kind of seeing what's going on and learning about what is going on in the field of medical coding in healthcare. Once you complete the course, the objective is for you to have a level of expertise in reviewing and assigning accurate medical codes, to be proficient in a wide range of services, whether it's anesthesia, surgery. The exam is going to test you on all of it, on all of those areas. So you have to have a level of understanding in all of those areas, which would mean a sound knowledge of medical coding guidelines and regulations, including compliance and reimbursement, which is covered in Chapter 1, the business of healthcare. Another objective is to have an understanding of how to integrate medical coding and payment policy changes into a practice's reimbursement process, and knowledge of anatomy, physiology, and medical terminology necessary to correctly code provider diagnoses and services. And I am going to do all that I can to make sure I provide the information to you to be able to achieve these objectives. The CPC exam. So there are two types of certification exams. There's an online proctored exam that you can take in the comfort of your home, with stipulations put in place by the American Academy of Professional Coders, as you can see here. So they have their equipment requirements, location, exam format, time allowed, proctored examinee ratio. So let me start over here with the physical location proctored. So there's either the online where you can do at home or physical location where you will be able to take either with your instructor or with your local chapter. So once you become an AAPC member, you will be assigned to a local chapter. That means if you live in Charlotte, there's a Charlotte chapter of the AAPC. Every city, major city, has their own chapter. It's how you stay connected and network with the people that are in your area. If you're in Charleston, Charleston has a local chapter. If you're in Orangeburg, Myrtle Beach, all of those areas have local chapters so that you can have people in your close proximity the same field that you do. So they do offer exams through the local chapters. Um, the physical exams where you go on site have 100 questions, multiple choice. It's a 4-hour exam. They typically have 25 people, 25 to 30 people in one room, and they'll have one or two exam proctors, and the proctors are there basically to make sure that, they're controlling the room, nobody's cheating, nobody's talking, they keep the atmosphere perfect for testing. Um, you can find a local exam in your local area through the AAPC's website. The proctored exam is a little bit different. So while the one in person is 4 hours, the proctored exam is broken up in two parts. So you get to have basically two sittings. Well, I shouldn't say it that way. It's broken up in two parts, 2-hour sessions. You only get one attempt with the online exam. With the physical exam, you can get 2 attempts. Those stipulations are broken down on the AAPC website, so I encourage you to visit that. And once we get into the course, I will share with you where you can find it. So passing the certification exam, all you need is a 70 to pass the exam. That means that you can miss, well, the exam used to be 150 questions. So all you need is a 70 to pass with 100 questions. That means you can miss 30. Yeah, it's still pass the exam. And I may be off on that, but you can miss 30%. As long as you have a 70%, you can still pass the exam. That gives you a lot of room for error, a lot of leeway. And as we're going through the course, I will give you tips and tools for success, tips and tools on how to quickly find things. This course is not about memory. So I don't want anybody coming into it thinking they have to memorize everything, memorize all the codes. All you have to do is know how to use the books, because you will be able to use your coding books during the exam. That is the way that it is designed by the AAPC. You can use your books during the exam. So, and these books are, the diagnosis code book is like 1,300 pages. The CPT book, I think, is about 500 pages. So the goal is to know how to navigate through the books, not to memorize the details of what's inside the books. So once you pass the exam, this demonstrates to an employer, so to someone like me who not only teaches this course, but I am also in healthcare management, and I hire medical coders. So I know what's expected. I know what I look for in someone who I would like to hire as a coder. I look for there to be a level of expertise, sound knowledge, proficiency in coding certain things. I look for the individual to be able to grasp anatomy and have an understanding of what medical coding is and the parts of medical coding. So I am the perfect coach to help you get to where you need to be, because I know what I look for in the person that I want to hire, and I'm going to make sure that you possess all of those things as you go out into the field to look for employment. Now, if you do not have any medical coding experience, which will probably be the bulk of you, unless you have 2 years of medical coding experience prior to taking the CPC exam, you will receive the credential of CPC with an A behind it. All the A means is that you're coming in certified, but as a certified apprentice, because you don't have the years of experience. It does not hinder you from employment, because when we talk about years of experience, this course itself counts as 1 year of experience. So when you go out and you get your coding job, You work on your job for 1 year. Then you can submit to AAPC to have the A removed. I hire coders with an A all the time. You'll see again on most um, job qualifications for medical coders. They want you to have the CPC credential. They'll have CPC or CPCA, um, which means again that you passed the exam, but you don't have the years of experience. Not going to hinder you from finding employment at all. This is a known national standard. So once you have worked on your job for 1 year, plus you have the 1 year experience of work of taking this course, then that means that you can have your A removed. There's also more details about this on the AAPC website. So career development, this is also something that's really important to me. I've been teaching for about 15 years. I have been developing coders. I've been training coders, coaching coders, because training and coaching is different. And just being there as a professional to help those under me be able to build relationships and connect and grow in this career field. So networking is very, very important. Estimates reveal that 70 to 80% of jobs are obtained through networking. So sometimes it just takes showing up to those local chapter meetings and introducing yourself and saying, hi, I recently became certified and I'm looking for a job in a pediatrics office or in an OBGYN office. You can pick what that one area is that resonates closely with you to say that's where you want to work or code in, and that's perfectly fine. So in Charleston, our local chapter is called the Palmetto Professional Coders Association. I am also listed just because I have friends everywhere, but I'm also listed in the Orangeburg chapter, which is about 45 to an hour, 45 minutes to an hour away from Charleston. I'm also listed in the Charlotte chapter, which is about 3 hours from Charleston, and in the Myrtle Beach chapter, which is about 2 hours from Charleston. So I don't mind traveling, or if they have a good workshop that I would like to attend, but they also do a lot of virtual meetings now, which makes it easier for me to network and be a part of those chapters, to gain more knowledge and to meet more people. So your resume, really needs to be sharp and up to date and highlight. If you don't have any healthcare experience, it really needs to highlight your coursework. So we can say in your resume that you have experience in medical terminology, anatomy, even if you haven't used that in a job yet, because you don't have the experience, but you have the classroom experience. So there's a difference in on the job experience and classroom experience, where your classroom experience is weighed just as heavily or is just as important as the on the job. Volunteering is important as well, if it is an opportunity for you to do that in your local community, and job shadowing. So if you can connect with someone who will allow you to shadow them on their job as a coder, that will also give you a new perspective, probably a higher level of respect and understanding of what a medical coder does daily. My encouragement to you as you learn more and go into the journey of medical coding is to just strive for the highest level that you can achieve, meaning put all of yourself into the work that you're going to be doing in this course. Coders and medical professionals are in high demand, so you've made the right choice. You have stepped into the right career field, because there's always going to be opportunities in healthcare. If you do have questions, you can certainly email me at certitudehealth@gmail.com, or you can call me at 843-575-7252, and I will be more than happy to talk to you more in detail about some of the things discussed in this presentation. But again, this was just a general overview to the journey in medical coding. So I hope that you have enjoyed this presentation, and look forward to speaking to you